Well, we need to get competition. We need to be able to cross state lines. And we also need to have legislation that limits Medicaid contributions and repeal certificate of need laws, because that's pretty cumbersome, and that would open up a lot of more competition and options for people. And we need to encourage more private opportunities for private insurance. We need to cap the Medicaid enrollment and encourage the private insurance companies. We need to eliminate and decrease fraud, waste, and abuse. We need to utilize telemedicine, reduce reimbursement rates, project direct primary care, so that we can get rid of the third party interference. We don't need government in our lives. We need to have a relationship with our doctor.
Before the ACA Affordable Care Act, we had 3 insurance companies, 5 prior to that. One insurance company, that is a monopoly. We need to be able to buy insurance across state lines, and if I'm not mistaken, that was passed with this new administration. So it's a matter of implementing it here in the state. I would also like to see more co-ops, doctors working together, or nurses working together, and cut that Medicaid expansion. That should have never been a decision for one person. There's a lot of able bodies milking the system. They need to work.
Wow. The entire system needs to be repaired. Costs are high. In many areas, costs are unconscionably high. And both government and the private sector need to be responsive. The cost of drugs and the availability of drugs within the healthcare system is the proximate cause of our public safety crisis. We need to address the entire matter across the board in a very aggressive way, and we need to do that on an ongoing basis, and Alaska has already made it a priority. The governor is working with other governors looking at recommending a healthcare system, yes, working with Senator Murkowski in order to create the healthcare system that is affordable in our state.
Yeah, that's a complicated issue, question, and I know our insurance director, Lori Winghire, I forget her last name, but I know she's been working very hard to get more insurance companies to Alaska. That the issue or the concern is we just don't have the people up here, the population base to attract more insurance companies. If you look at it, with Medicaid expansion now, we have almost 30% of our people are covered under Medicaid, and then you have several covered under Medicare, several covered under Native Health Services. So there's just a small group of people really that don't have insurance and need coverage. So I think if we could combine our people up here that need private insurance with other states like Washington and Oregon, and have a larger pool, that we could get more insurance companies to come to Alaska.
All right, Stephen Wright again. As far as insurance goes, for me, I kind of I've seen it from a couple different perspectives. Having been in the military, retired military, I have a TRICARE Prime. You also have the VA healthcare system. And when I taught school down in the Southeast, they told me I needed to be on their program so that there'd be enough volume there so that they wouldn't lose policy, or they wouldn't have reduction in care from their policy. So I think it's something that we really need to look at. I think also that it's important to be able to consolidate a lot of these services, because the only way you're going to get efficiency out of this is if you consolidate services. So basically, I asked to opt out because I already had a better healthcare plan already in place. And so even they were spending upwards of $3,000 a month on my healthcare. So anyways, it's something we need to look at. We have services that actually cross over. We need to look at those and make sure that that stuff's taken care of. Thank you.
This is a good question, because I've worked in HR and I've had to negotiate health insurance plans with the companies that I've worked with. And one of the things that is a big issue that you just heard is that you have to have a large enough pool of people in the plan to make it less expensive. In other words, you have to spread the risk. They're in it for a profit, and if they're not going to get the profit off a small group of people that are in the plan, then I think it's up to us to look at expanding that pool to where it's reasonable. I don't know why this is not going on, but so it has to be a bigger pool in which to spread the risk among younger people as well as older people, so that you're not spending a lot of money paying for a premium because the risk is too high with a small group. That's the way insurance companies work.
So I had a bill in the House that talked about pooling insurance, and quite frankly, where I got that from is sitting on our local school board, when one of the costs we could not contain was health insurance. Senator Dunleavy and I both sat on the same school board, and we saw the same things. We said we can't make a difference on a local level, but we can attempt to try to make a difference on a statewide level. That being said, some of the things that I've personally done is instituted a telemedicine bill where we all now, it took 4 years to get through, 2 years to be able to get the bill through, and then another 2 years to allow doctors that were not physically in Alaska. But we got to think outside of the box, folks. We got to go wherever we can to find cheaper costs, including if we have very expensive treatments here in Alaska, that it's less expensive to go somewhere else. We have to look at that as well. Thank you.